Welcome to today's class, that is anti-hyperlipidemic drugs. Today we will discuss about a little about hyperlipidemic agents, what are anti-hyperlipidemic agents, and a classification, in the classification a class, that is fibrates, we will discuss today. So, what are anti-hyperlipidemic agents, or what is hyperlipidemia? First of all, let us discuss about what is hyperlipidemia. When there is a increased amount of fat in any form, either it is cholesterol, either it is cholesterol esterase, phospholipids, triglyceride, anything, any fatty thing which is increased in our body than a certain level, then it will, the problem is called as hyperlipidemia. And that excess amount of fat, either it is cholesterol, cholesterol esterase, phospholipids or triglyceride, when this flows in our bloodstream excessively, then it is a very dangerous form of disease which can lead to many other diseases. The first of all is obesity. When hyperlipidemia hits a person, that means the underlying problems, the first very most important underlying problem is your cardiac diseases. Anti-arrhythmia can happen, myocardial infarction can happen, atherosclerosis, this all thing can happen because of hyperlipidemia. That means all the high end diseases that are cardiac diseases are the next step of hyperlipidemia. So, we need to control this hyperlipidemia. The meaning is, when there is an excess amount of lipid present in the bloodstream, then it is called as hyperlipidemia. We need to control this hyperlipidemia as soon as it is detected, so that it cannot lead to any further disease, any heart disease. What are the causes of hyperlipidemia? Basically, the hereditary factor is a very important thing. Hereditary factor, a high saturated fat and cholesterol diet. Next, if the person is dealing with diabetes mellitus, then kidney diseases or hypothyroidism, that are again the causes for hyperlipidemia. Next, certain drugs, if a person is on medication of these certain drugs or certain hormones, then the person can have hyperlipidemia, the chances are there. That means the drugs which are estrogen is an hormone, corticosteroids, retinoids, protease inhibitors, thiazide diuretics and beta blockers. If a person is taking these medicines or on the hormone therapy, then he or she can have hyperlipidemia. Obesity is again a very big reason, chronic alcoholism and smoking. These are the general causes of hyperlipidemia. What are the symptoms? How one can get to know that the person, that the affected person is there? How to get to know that what are the symptoms? Hyperlipidemia itself does not produce any symptoms, but the levels of lipid is so much high that the person is showing other problems, other related problems like atherosclerosis. Atherosclerosis means if a person is suffering from chest pain or heart attack or stroke, the first thing a doctor is get to know, or the patient is tested by the doctor, is for atherosclerosis. What happens in atherosclerosis? The veins, the arteries get captured by the lipid layer. That means, see, if it suppose this is an artery, okay, from the blood flows, and here is the formation of some plaque. What will happen? This plaque will restrict the movement of blood, that means here this space is much lesser than this space or this space. So, the pressure here will increased in the arteries or in the veins when there is a formation of plaque or when there is a deposition of lipids, so much of it which created pressurized outflow of blood. Now, the blood which is coming out of this artery will be in pressurized form. Let us take an example. If you have water your garden sometimes with the use of a rubber pipe, if you have seen try to push the mouth of the rubber pipe with your hand, what you will see, the water will go with too much force and it will cover a lot of distance. But if you release the mouth of that pipe, what will happen? The water will fall there only. So, if you are creating some kind of blockage in the arteries or veins, what will happen? The blood from that artery or vein will flow in very pressurized form. So, it will go into the heart, into the liver, into the lungs in that with that pressure only. So, what will happen if these organs, these vital organs will get this high pressure blood all the time, they have to work more fast. They should work more fast to clean the blood, to filter the blood, to pump out the blood, to oxygenate the blood. So, what will happen? These vital organs will have to work very efficiently, faster than normal rate. This will ultimately cause problems. So, the first thing, that is atherosclerosis, will be creating so much of problems. Those are first symptom, atherosclerosis. Next, if high cholesterol may be deposited on tendons or just beneath the skin under the eyes. You have seen people with puffy eyes. What are that puff? That air gap, what is that? That is the deposition of cholesterol. That is the space where the cholesterol or lipid is get deposited and affecting the tendons, which is just beneath the skin. Then formation of nodules. You have seen patients with, there are certain nodules on their elbows, that means on the joints. There are certain nodules have formed. What are those nodules? Those are made up of fats only, those are made up of cholesterol only. Swelling of the organs, this is the very important and very basic thing nowadays we can see that a patient which is having hyperlipidemia is also affected by weak liver, weak spleen and weak pancreas. So, the doctor has to put the patient on a diet to lower his or her lipid intake. And last is blockage of blood vessels in the brain and heart. This we have discussed that if there is a plaque formation in any blood or artery, the pressure of blood flowing through that artery will increase so much that the arteries and veins in the rest of the body other than heart, brain, they also get affected, but the vital organs, they are affected the most. Types, what are the types of hyperlipidemia? First is your hypercholesterolemia. If you see, there are three words which are making this full word, that is hyper, that means elevated, cholesterolemia, that means high level of cholesterol in your blood, hypercholesterolemia. Next, that is elevated LDL level, LDL cholesterol. LDL means low density lipids. There are three types of lipid which we should know before studying this. One is HDL, the other is LDL and last is VLDL. These all are the types of cholesterol. Every time cholesterol is not bad for us, but other than that cholesterol, there are some good cholesterol and most of them are bad cholesterol. So, HDL, that is called as high density lipid, is your good cholesterol, also called as this is your good cholesterol, whereas LDL, that is low density lipid or bad cholesterol, and last is your VLDL is very low density lipid, or very bad cholesterol. So, as you can see, there is a formation like this, the good cholesterol, that is HDL, LDL is bad cholesterol, and very bad cholesterol is LDL. When a person is suffering from hyperlipidemia, that means the person is having too much quantities of these two, LDL and HDL, more than HDL. LDL and VLDL more than HDL. A person should have more HDL, that is good cholesterol, is considered as healthy, whereas a person is having LDL or VLDL is considered as having bad cholesterol too much and is affected by hyperlipidemia. Okay. So, if a person is having hyperlipidemia, he needs to get treated for that. So, what will happen? What will the mechanism of eliminating out the cholesterol? What will be the mechanism? The VLDL will converted into LDL, and ultimately the LDL will get converted into HDL with the elimination process. So, VLDL present in the body, which will get eliminated by converting it into the LDL, which will get eliminated by the body by converting it into the HDL. So, HDL is good cholesterol, whereas LDL and VLDL are bad cholesterol. So, it should be clear, hyperlipidemia means having too much quantity of LDL and VLDL. Okay. So, types are hypercholesterolemia, that is elevated LDL-C, that is low density lipid cholesterol, then hyperglyceridemia, ग्लिसराइड्स यानी कि ट्राइग्लिसराइड्स बहुत ज़्यादा है यहाँ पे, तो एलिवेटेड टीजी, दैट इज ट्राइग्लिसराइड, एंड कोलेस्टेरॉल ये बहुत ज़्यादा हो गया एलिवेटेड, whereas they have normal LDL cholesterol. Then combined hyperlipidemia, it has, the person will have elevated triglyceride and LDL cholesterol. Mixed hyperlipidemia, the person will have elevated cholesterol and triglyceride with IDL. And last is chylomicronemia, that is triglyceride more than 1000 microgram per DL. There is a chart which a person who is having hyperlipidemia has to follow in its diet, so to eliminate out the extra bad lipid which is present in his body. Next is the classification. What we are studying here is, we are studying here anti-hyperlipidemic agents, which are also called as lipid lowering agents, or they are also called as hypolipidemic agents. That means these are the medicines, these are the group of pharmaceuticals which are used in the treatment of hyperlipidemia, and they are used to eliminate out the bad cholesterol from the body. How they are using, how they are doing their work? They do by reducing the lipid level in the blood, they basically lower the LDL, the agents will lower the triglyceride, that means the bad type of cholesterol is getting eliminated, that is triglycerides, that are lipid, that is LDL and VLDL, and increase the HDL level. So, this is the basic work which an anti-hyperlipidemic agent has to do. So, here is the classification. The classification includes, there are classes like HMG coenzyme A reductase inhibitors, generally we call it statins. Second is, the example for this is lovastatin, pravastatin, simvastatin, atorvastatin, rosuvastatin and flavastatin. Next is your bile acid binding resins, or it is also called as BAR resins, secutrens, sesquiterends we can generally call it. Examples are cholestyramine and cholesterol. Third is your lipoprotein lipase stimulators or fibrates. Examples are clofibrate, bezafibrates, phenofibrates and gemfibrozil. And last is miscellaneous drugs, that is nicotinic acid, probucol, ezetimibe and gugulipids. So, this is the classification. The general 3 broad classes are your statins, sesquiterends and fibrates. Today we are going to discuss about the fibrates. First of all, let us see about the mechanism of action of all the big classes. So, you can see the mechanism of action of all the classes. First of all, let us discuss about the statins. Statins are working, you have studied in biochemistry in I think first year, that cycle of glycolysis, you have studied about it. Okay. So, what happens in glycolysis? Your glucose hydrolyze and finally converted into pyruvate in liver. Okay. So, glucose will converted into by the process of hydrolysis, it get converted into pyruvate, where with acetyl coenzyme A it will form HMG-CoA reductase enzyme and forms mevalonic acid, which ultimately leads to cholesterol. So, if we write it down like glucose after glycolysis, it forms pyruvate, which then plus acetyl coenzyme A acetyl coenzyme A, it will form HMG coenzyme A reductase mevalonic acid and ultimately formation of cholesterol. If you can see the whole thing, that is first carbohydrate metabolism and then it is converted, the metabolism is then carbohydrate converted metabolism is converted into fat metabolism or lipid metabolism and there is a formation of cholesterol. Statins work here. Statins, what they do? They inhibit this HMG coenzyme A reductase and stop here the cycle so that it cannot further form cholesterol. So, if a person is suffering from hyperlipidemia, he can be given with statins. What statins will do? Statins will stop the this cycle at the point where HMG coenzyme A reductase forms mevalonic acid. This steps is cancelled out and then there is no formation of cholesterol. So, statins work like this, as you can read it out here as well. Statins inhibits HMG coenzyme A reductase and it decreases the synthesis of cholesterol. So, finally, it decreases the amount of LDL. LDL is low density lipid. Next is fibrates. How fibrates work? Fibrates ultimately increases the lipoprotein lipase. It increases the lipoprotein lipase synthesis in the body and finally, they increase the degradation of VLDL. Degradation of VLDL means VLDL is again distributed or divided into its smaller parts. So, if it is divided into more smaller parts, it will be dissociated into more smaller parts, then it needs to get elimination very hard. The elimination of VLDL is now very hard. So, here the degradation needs to be increased. Increased degradation of VLDL means VLDL needs to be degraded fast, so they needs to be broken down into more smaller parts, so that they can eliminate out from our body easily. Okay. So, increased degradation of VLDL, and finally what will happen? Triglyceride level will be decreased and the LDL level will be decreased out. Last is your BAB resins, bile acid resins, bile acid binding resins. What will happen here? They are basically positively charged ions. They will bind with the negatively charged bile acid which are present in the intestine. Now, what will happen if they bind with the negatively charged bile present in the intestine? So, the absorption of the cholesterol, the bile is then converted into, normal process says when the bile goes into the intestine, it then converted into the fat part. So, it will convert, it will here if it is binding with the negatively charged bile acids in the present in the intestine, then there will be the absorption prevention of cholesterol. So, this way your BAB resins will work. So, this is the mechanism of action, general mechanism of action of statins, fibrates and BAB resins. I want to repeat it once again. Statins, how they work? Statins will work after the glycolysis cycle, when your glucose, that means after the, this is your carbohydrate metabolism and this is your fat metabolism, part of your fat metabolism. Okay. So, after the carbohydrate metabolism, your pyruvate will get converted into mevalonic acid by the use of HMG coenzyme A reductase. Here what will happen, your statins will act on and stop this process, stop this step. Finally, your mevalonic acid will not able to convert into cholesterol. So, finally, your LDL will be decreased. Fibrates, how they work? Fibrates simply they increase the lipoprotein lipase synthesis in the body. What lipoprotein lipase do? It breaks down the fat into more smaller parts. So, if lipoprotein lipase will increase in the body, the degradation of cholesterol will increase and ultimately the degradation of VLDL will increase. It will dissociate into smaller parts fast and more efficiently, and then decreased level of triglyceride will be there and the LDL, that is low density lipid, will be decreased. And last, the third big class is BAB resins, that is bile acid binding. As the name suggests, it has to bind, that means the positively charged resins, which are the medicines, which are the drugs, they get combined with the bile which is negatively charged and present in the intestine. They get combined with them and prevent the absorption of cholesterol in the intestine. Hence, decreased level of LDL, that is low density lipids. Now, let us see the synthesis of clofibrate, that is I told you that we are going to discuss about the fibrates today. So, clofibrate, how a clofibrate made? When 4-chlorophenol, this is phenol and fourth position it has a chloro group. So, 4-chlorophenol when reacts with acetone and a chloroform in presence of NaOH, that means we have given a basic environment, a base reaction is going on, a basic environment is given to this. Then there is a formation of 2,4-chlorphenoxy isobutyric acid, 2,4-chlorphenoxy isobutyric acid, and in presence of ethyl alcohol will be the vehicle for conducting the reaction further. We will found our clofibrate, which is also called as ethyl ether 2,4-chlorophenoxy isobutyric acid. This is the IUPAC name of clofibrate. So, how it is made? It is very easy. 4-chlorophenol is reacted with acetone and chloroform. In basic environment, we are reacting it with NaOH. and it will convert it into 2,4-chlorophenoxy isobutyric acid, which in presence of ethyl alcohol and hydrolysis is happening here. So, ethyl alcohol, it will form ethyl ether 2,4-chlorophenoxy isobutyric acid, that is called as clofibrate. Like this you can do the synthesis. Now, SAR, let us see the chemistry of clofibrates. The general group, the general structure you can see here, this is the structure of clofibrate. This is written like this. It is very easy to understand. This is the aromatic ring connected with an bridge, oxygen bridge. This is the bridge. This is the spacer group. This is the spacer group, and this this is the spacer group, and this is the last connecting part of your clofibrate, that is ethyl acetate. This is it, okay, connected like that. So, aromatic group when bridge with spacer group with an oxygen, this is the rest of the part. So, we can write down the SAR of fibrates like where that fibrates, they are chemically classified as analogous of phenoxy isobutyric acid. All the compounds are analogous of the isobutyric acid. As we have seen, there are certain places which we can see isobutyric acid, which we can see. So, these are the analogous of isobutyric acid. It is a very important group for activity, that means the isobutyric group is very important for its activity. Next, analogous of that, that is phenofibrate. It contains an ester group which is a prodrug and requires in vivo hydrolysis for activity. We know there are two types of activity we can see, in vitro and in vivo. In vitro means the activities which can be performed in laboratory, that means outside the body, whereas in vivo means inside the body. So, it requires in vivo hydrolysis for activity, that means after taking the medicine, after taking the phenofibrate, we are discussing about phenofibrate here in this point. So, after taking the phenofibrate will get dissociated, hydrolyzed inside the body, and then it's having an ester group which is a product which is hydrolyzing inside the body and shows its activity. Next is substitution at the para position of aromatic ring. Aromatic ring के para position पे अगर आप activity substitution at the para position of the aromatic ring, it produces significant longer half life. That means para position पे effect ज़्यादा दिखेगा अगर वहाँ पे substitutions होंगे. And last is your most compounds contain a phenoxy isobutyric acid, the addition of an N-propyl spacer in this place. N-propyl spacer as seen in gem fibrosol, which is result in an active drug. So, there are certain changes, there are certain modifications done in the full structure of your fibrates, that are clofibrate. We can have many analogous, any derivatives of your active fibrate units like phenofibrates, and here is the gem fibrosol. These are the references which we are using for this. Let us quick revise. So, hyperlipidemia, as we saw, hyperlipidemia as the name suggests means hyper means more, lipidemia lipid in blood, demia means blood. If there is an excess of lipid present in the bloodstream, then it will be called as hyperlipidemia. What kind of lipids can be seen? Cholesterol, cholesterol ester, phospholipids and triglycerides. Next, what are the causes? The general causes, the sedentary lifestyle of ourselves, the obesity, alcoholism, smoking, hereditary factor, diabetes mellitus, and certain medications can cause hyperlipidemia. Next, what are the symptoms of that? Hyperlipidemia itself does not have any symptoms, but it is associated with certain diseases. Which are the symptoms, which are the highlighted elevated symptoms of hyperlipidemia? First is atherosclerosis. As we discussed, atherosclerosis is the plaque formation in the arteries or veins, which then increases the pressure of bloodstream which is flowing through that artery or vein and causing damage to the vital organs, which is kidney, lungs, heart, brain. And then there are nodule formation in the elbows and knees, that means the joints, and swelling of the organs is very common, is seen today's life, that is liver, spleen and pancreas, and blockage of the blood veins in brain and heart. Next, what are the types of it? There are certain types of hyperlipidemia. Hyperlipidemia, hypercholesterolemia, hyperglycemia, combined hyperlipidemia, mixed hyperlipidemia, and chylomicronemia. Classification, there are 3 major classes, that are statins, sesquiterpenes and fibrates, and some miscellaneous drugs are there which are helpful in combination with these major classes. These are the mechanism of action which we discussed already. Statins worked on the HMG coenzyme A reductase enzyme and stop the synthesis of cholesterol, whereas fibrates increases the synthesis of lipoprotein lipase, which is an enzyme to degrade, to dissociate the VLDL, that is very low density lipid, and BAB resins, that is bile acid binding resins, are positively charged agents which we see that bind with intestine to decrease the formation. This is the synthesis which we discussed and the SAR. Here are the references. Thanks for today. Thank you.